Good morning. My name is Susan Fados. I'm the Executive Director of the XLH Network, and I'm coming at you live from XLH Week 2020. On behalf of our entire network board and staff, welcome. Things do look a little different this year, but our commitment to our goals and mission remain the same. XLH Week 2020 will still provide you with the education and resources you are used to. There are still networking opportunities within the app and on each Saturday night. And while you'll see many familiar faces among our speakers, we are also delighted to be able to bring you some new speakers, events, and activities this year. The purpose of our annual member events aligns with the mission of our organization: to create resources and a community for those affected with XLH and related disorders, to provide a space for connecting with others, where one can feel understood and accepted, and to leave that event armed with the resources and knowledge necessary to manage this whole life, whole body, whole family disease. Our entire community has been affected by the COVID-19 pandemic. For those of you that are still experiencing direct effects, please know that we are here to support you and to provide resources when we can. We are hopeful that by this time next year, we can once again meet in person and hug our friends, connect with our new members, and have an XLH day like we're used to. If you have, for today, I will encourage you to attend as many sessions as you can this week. Take advantage of the networking opportunities in the app. And don't forget to check out the game section where you can win prizes for attending sessions throughout the week. If you have any technical difficulties, please reach out to us by emailing info@xlhnetwork.org. Again, that's info@xlhnetwork.org. Again, on behalf of the entire network board and staff, thank you for being here today. I'm going to shift gears here just a little bit, and I'm going to now introduce our first speaker, Nicole Boice. I first met Nicole about 4 years ago at a small meeting room in a Dallas airport hotel. I was immediately taken by the warmth of her spirit, her energy, and her willingness to help. Little did I know that this woman sitting across from me was actually the founder of Global Genes, the world's largest rare disease advocacy organization, which empowers patients, educates advocates, and creates resources for those living with rare disease all around the world. Nicole is a driver, a motivator, and a collaborator. She recently founded another rare disease organization, RareX, which works with rare disease communities to gather and share their data with collaborating researchers around the globe in the interest of accelerating progress in rare disease research. Nicole has been described as fierce and unstoppable, and someone you want on your team when you're trying to make the world a better place. Back in that meeting in Dallas, I was a little starstruck when I realized who Nicole was. And to be honest, part of me still is, which is why it is my great honor and privilege to introduce our next guest speaker, Nicole Boice.
Thank you so much, Susan. I'm all choked up. Thank you so much for offering and inviting me to come and share my story today. So thank you so much. You mentioned two words, fierce and unstoppable. And I guess what I would say in the spirit of this keynote presentation today, the rare journey is what unites us all. But it's also that fierce and unstoppable spirit that everyone has that touches XLH or all of the rare diseases that we are also involved with, and that you guys are part of a family or part of this larger family. Susan, as someone over the last decade who's hosted many, many events, I know what an undertaking this is, and I just want to congratulate you. This is extraordinary. And for everyone on the call, I know sometimes, when things are perfect, it seems like everything's easy, but there's so much time, talent, treasure, work that went into this, and I just wanted to recognize just the extraordinary work. And thanks, Susan, again for everything. She is a fearless and unstoppable leader for all of you. And like I said, I'm honored to be here today. So, the purpose of my presentation was to share a little bit about my story. And I think, in the spirit of what drives us all, what brought us together, sometimes might be a little unique, but there are so many elements and things that are similar and common. And in most cases, we all have our why, whether it's you're a parent or you're a patient advocate or you're were inspired by someone in research and therefore you're dedicating yourselves to focus on XLH or other rare diseases. Um, but it's kind of that spirit and that interconnectedness around kind of what drives us, that those commonalities. It has what it is the basis to what has created this just extraordinary community in rare disease. So my story begins in, gosh, 20 something, 23 years ago, when my best friend was born in Laguna Beach, California. And he was born with extra fingers and toes and bowed bones. At the time, he had a misshapen head. They thought he was blind. He was not progressing. He was in the hospital for the first 6 months of his life. In that time, mom and dad, who were not prepared at all for this situation, were struggling kind of with the meaning of it all. And with no prognosis or no diagnosis, and many months of seeing different specialists, mom and dad, my friend Kelly and Daryl, were sent home with Derek with no answers. And over the next 4 years, they struggled kind of coping with their new norm and the new realities that faced them. But without answers, it was really difficult. It was scary. You saw just an extraordinarily open and social couple, um, become very isolated and alone. And at the time, I didn't really know much about rare disease, even though my history is in biotech and pharma. And I, at the time, was working in an organization where I had the good fortune of meeting with a lot of heads of research and heads of biotech companies. And I remember thinking to myself when all of this was happening with Derek, how the hell in this day and age, with all of the extraordinary minds and, you know, um, talent and time and effort, and we're smack in the middle of some of the best healthcare in the world. With all of that, how is it that no one knows what my friend's son has? And it started kind of generating this anger in me because at the time I felt I'm surrounded by some of the smartest people on the planet. Like how do we not know what's happening? So over that 4.5 year diagnostic odyssey with my friends, I started meeting other families. Kelly and Daryl brought Derek to an early intervention center in Southern California. And there were a lot of individuals, many kids that were taking advantage of a lot of the resources there. And I saw a lot of Down syndrome uh, children. And then I started noticing that there were a lot of other kids there. And when I started asking about the types of conditions that they were maybe affected with, I started hearing all of these names of conditions that I'd never, ever heard of. And I thought that I'd kind of heard of a lot. And so that kind of prompted me to go do this searching and start scouring. What are all these conditions? What are these names? Like, what is this? And that's when I landed kind of in the world of rare disease. And what I saw was overwhelming. It was shocking. I was surprised. I was angry. And that was something that started catalyzing this desire to go out there and try to figure out what to do. Now, let's be clear. I'm not a researcher. I'm not a scientist. I'm not a biopharma executive. I'm actually someone who's pretty much been a schleppy salesperson all of their lives. I've been in sales and marketing, and that's the world I lived in. But there was something in this whole story and this world that transformed like everything about what I knew I needed to do. And so I consider myself a champion for rare disease. And at that moment in time, 20 or 15-ish years ago was when I knew I needed to do something different. And I left my career. And I did so with the urging of two of my colleagues from my for-profit job. And they happen to be two biotech CEOs that are also parent advocates, John Crowley and Brad Margus. And their stories also inspired me to go forward. And regardless of the fact that I didn't have relevant experience to start driving research or do anything, they said, we need energy behind rare disease. There's so much that needs to be done. And so, kind of with their urging, with looking at incredible Derek and my friends, I decided that that I needed to figure out something, and to try to determine what I could do. Derek, 4.5 years into his journey, life journey, he was had a fluke diagnosis of Joubert syndrome. So he was born without part of his cerebellum. He was born without part of his brain. And I remember at the time when they found this out, I thought, how did the clinicians in my hometown miss that? And again, started seeing and realizing that there were so many gaps. And it's not the fault of clinicians. It's just the fact that what we started seeing is that rare disease as a disease community is massive. Derek, today, I am excited to report the family moved from Southern California and moved to an extraordinary community in Bozeman, Montana, where Derek had access to a ton of resources, a place where he could learn how to ride horses and swim and have all sorts of different therapies and treatments. And because of the extraordinary work of his mom and dad, and their commitment, Derek is thriving despite the odds. And I give so much credit to just the extraordinary work, commitment, positivity, that mom and dad, my friends Daryl and Kelly, showed, to ensure that Derek could live his best life. About 5 months ago, Derek was needed a kidney transplant. It's kind of something that happens within this disease, and ironically or luckily, both mom and dad were a match. So my friend Kelly decided that she was going to donate her kidney. And suffice it to say that my friend Kelly's a big, huge baby and was whining and complaining the whole time, and Derek rocked the surgery. And so he is thriving now and back at his work. He drives around his little golf cart on a golf course and socializes with people there and does some gardening work, and he is living a full life and thriving. He also graduated from a special program in college and exceeding everyone's expectations. So this is my why. An extraordinary family, of the Seymour family, of amazing Derek, and my dear friends, Daryl and Kelly, are kind of what drove me to my what's next. So I talked a little bit about what I started uncovering while I was learning a little bit about rare disease. And as someone who's always been in sales and marketing, I think you could see why I was a little bit concerned. And I'm not sure how much you guys know, but XLH is one of now over 9,500 rare diseases that exist. Again, the largest disease community on the planet. More people are impacted by rare disease than all cancers and AIDS combined. And that's large. And so at the time, I kept thinking, gosh, I mean, I know that there's the importance of all of the disease-related efforts that need to happen, and that community of understanding and resources and the education that needs to happen. But what I also realized is that there is a long tail of rare disease where individuals, probably like when XLH started, are kind of getting thrown into this world of rare disease, and they don't really connect with, and it's difficult to find others in their community. And so I knew that there was this, the larger rare diseases like we all have heard of, cystic fibrosis, possibly Duchenne muscular dystrophy, or some of the other muscular dystrophies, spinal muscular atrophy, and others. But there was this massive community of emerging rare diseases and disease communities that also needed support. So I knew that there was something that we could do maybe to help get people off on their best foot forward. And then what I also loved and what I had also dreamed of was, at the time, over a decade ago, I remember running in some breast cancer and AIDS races. And I just remember, even though at the time I didn't know anyone with either, I felt this sense of community that was so overwhelming. Um, for everyone that was participating, I thought, God, we really need to figure out how to do that in rare disease. We need to figure out how to wrap our arms around this community and ensure that people feel connected, not only within their disease, but within this larger ecosystem. And so, as a result of all of these, the stats and facts that you're seeing here, the fact that there's so few treatments right now, XLH is obviously, super fortunate that there's so much activity right now in XLH. There's a large majority of rare diseases that don't have activity right now on the research side. So the importance is, and the importance of what we started learning and what happened is, A, there's a massive community out there. B, we all need to learn from each other, right? There's amazing work that you guys are doing at XLH that other smaller burgeoning communities could learn from. Susan is a leader in the rare disease ecosystem, and there are many people that look to her for guidance and advice and best practices. Because one of the things that we don't have is we don't have a lot of time, we don't have a lot of resources, and we certainly don't have a lot of money in this world. And so the ways that we could come together and really help connect and try to accelerate all of our timelines in whatever areas that we wanted to participate in was really important. So that's kind of the story. That was my catalyst to start what at the time was Global Genes. And so Global Genes really, as Susan discussed, it was really focused on what I kind of described, trying to build kind of an interconnected community, trying to create an environment that supports best practices and the brilliance of others and tries to determine how to disseminate that down to others who are starting efforts. We also built Global Genes in the spirit and knowing the importance of collaborating. Again, at the root of everything that we did, it was about how can we learn from each other? How can we learn so that we can move forward faster, more quickly, remove barriers? And so that became part of everything that we did. So Global Genes, over the course of a decade, started working with over 750 patient advocacy organizations with footprints in 20 countries. We also worked with over 100 biopharma partners. And one of the things I also wanted to say was, and you'll see this on a coming slide, is that we also, from the get-go, realized something very important. And this is in the spirit, and kind of, I'm saying this as a reaction to, over the last several years, the media coming forward saying that patient advocates and advocacy organizations are, shouldn't be working directly with industry, that they're being taken advantage of. And you know what? We've never bought into that, because here's the reason. It takes 4 key stakeholders to get a treatment across the finish line. And if any one of those isn't collaborating and working together, we will not have a treatment. So here they are: academic researchers, patient advocacy organizations, industry, and the government. Any one of those not on the team, not working together, we won't have a treatment. So from the get-go, Global Genes has always supported and worked with industry as a vital partner in helping ensure that patients can get future treatments and cures that we so desperately need. In the spirit of the evolving roles and responsibilities that I'll share over the last decade that have landed in the patient community, Global Genes started evolving. And it started evolving what we brought forward around education. And as a result of that, it became clear, and this kind of goes back to what I just described, that patients and their role in helping drive drug development, that sounds super fancy and scary, but has become more essential. And therefore, for those that would come to Global Genes and ask for support, what we started bringing forward from an education perspective also started evolving. And I'll talk a little bit more about that. But patient advocates soon, well into the last decade, really started becoming vital partners and contributors in helping drive future treatments, therapies, and cures from the get go. And I'll explain a little more about what that looks like. But we've talked a lot and we've heard a lot over the last decade, a term that also just weighs on me, and I'm trying to encourage everyone to not say it anymore. And that is the patient voice. Over a decade ago, the patient's voice and the patients were involved maybe in some conversations with researchers, but primarily were contacted when it was time to become part of a clinical trial. And the patient voice was taken for what it was worth and integrated maybe in a few places as industry forward. But that has drastically changed over the last decade. In fact, it's no longer the voice of patients that are so critical in this whole process. It's that patients are vital partners and contributors to this process. And we'll showcase a little bit about what that looks like as well. So on the heels of this evolution within patient advocacy and the expectations that are coming to patients, we spun out a new not-for-profit that spun out of Global Genes and its medical and scientific advisory board, and with advisors from our board of directors and patient advocates, called RareX. And RareX really exists to do a couple of things. First and foremost, it is working to break down the data silos that exist right now within the rare disease community. Because there's data that exists in biopharma, at academic research institutions, and even that is being brought forward within patient advocacy orgs. There's also data that resides here in the US and then is being stood up in places all around the globe. There's new technology out there that's transforming biomedical research, and it's called federated data and federated data sharing platforms. And so we are working with the Broad Institute of Harvard and MIT to bring forward a heavily invested in technology that will support and open up and silo break a lot of these data silos that currently exist. Secondly, we also are looking at transforming and new approaches to data collection. Because, not surprising, and I was listening to the researchers that were on the previous session, is that there's a lot more, and Chris Austin will tell you this from NCATS at the NIH, and Janet Woodcock from FDA will also say this. There's actually a lot in common, more in common with all of these different diseases than there is different. So it's kind of that 80-20 rule. And as a result of that, and as a result of both the FDA and the NIH looking to try to accelerate and identify new treatments and therapies for the 9,500 rare diseases, we're approaching data collection differently. 80% of the data that's collected needs to become standardized and structured by domain, meaning by hair, skin, renal system, by different systems and phenotypes. And as the data is standardized with the best data looking across all sorts of different data, what we call, data dictionaries, right? So the questions that have been asked the patients and the patient communities, we're looking across those that were stood up at the NIH, the Library of Medicine, the National Library of Medicine, within industry, researchers, etc. We're building consortiums around data standardization so that data collection and the right data becomes as easy as drop-down menus. This is going to make your lives easier. This will make the patients' lives easier. It will be free to patients. It will also de-burden patients, because one extraordinary piece of this is you shouldn't have to be answering as more research comes forward for your condition. We want to de-burden the patients. If you're asked to participate in 5 different studies and you have to have answers the same 500 questions 5 times, the likelihood of you participating in all 5 of those studies is going to be very low. So this platform will also really keep in mind that. De-burdening patients, being mindful of your time, effort, etc. So that's Rare X. So the other part of my discussion today is really about not only this whole ecosystem and what it really means to be a patient advocate in rare disease, but we also talked about just the growing responsibilities that exist right now for patients. And I think my hope from this discussion was really to showcase that regardless of where you are on the journey, the experiences that you have, where your comfort zones are, that there's an opportunity for you to play ball. And that anything that you do is going to be really important and meaningful. And also that the ability for you, or the hope that you will participate in rare disease, we use the term, it's not a nice to have to be a participant, it's a have to have, right? Because our diseases are small and there's so much work to do. So the most important thing is finding your lane and finding that thing that you can sink your teeth into and contribute in. And so I wanted to talk a little bit about that today. So we kind of identified 3 really main buckets that are kind of related to this huge journey. One is just your day-to-day. For some individuals, ensuring that your household, that your patient community, or that your kids, that yourself, that your loved ones are taken care of, that the health is being managed, and that you can get through each day, and that you can thrive. And if this is where you land, and that is what your focus is, and that's what you need to do, then rock on. Because that is so important. To have a really solid base and family and support system, and ensure that you can be caring for those that are impacted, or that you as a caregiver are also taking care of yourself, is critical. So please note that if that's the area that you are comfortable in and that you have time for, then own that, because it is really important. The second kind of area that we identified is really about kind of architects. Some people start looking at, okay, I now have to become a lot more engaged and involved, not only around my loved one or my child's health care. I have to go out and actually kind of architect and piece all of this together. And then if you're someone in a rare disease community that might not have a lot happening, you also have to go out there and start architecting what needs to happen within your community. And that architecting, or that kind of general contracting, can happen in a ton of different areas. So as you'll see on this chart, and please note, we certainly understand that this is not a linear process, but there's a lot of buckets and places that you can become an active participant in. On the front end of all of this is the diagnosis. It's even helping other people find a diagnosis. There's technologies now like whole genome sequencing and other genetic testing that can help really accelerate that diagnostic odyssey and that journey. There was, for my friend Kelly at the time, a genetic test that existed for Joubert syndrome, and no one knew about it. That would have given them answers so much earlier in their journey. And answers and knowledge is power, and that allows you to take some of those next steps that you wouldn't be able to otherwise. So we always look at diagnosis as really critical. Also, becoming a disease expert. All of you right now have become disease experts, and there's no one that knows more about the condition, how it affects you and your body or your kids than you. So own that. You are an expert. And know that the value of what you have and the knowledge that you're gaining and that expertise is so critical. So be open to sharing with colleagues, friends, people in your community, and also researchers. Some individuals and community members want to build outreach. And I know we're talking a lot about XLH as a community, but I guarantee you in your hometown, there may not be another XLH um, community member in your local community, but there sure as heck people affected by other rare diseases. And there's also that unifying or that familial love that you can find and support network also locally. So maybe outside of efforts that you want to participate in for XLH, there's also things that you can kind of start locally, connecting with others, building support, even if it's just coffees. So we look at architecting kind of the health of you, yourself, your friends, your family, but we also look now at how can you become active and help contribute to the work that might be being done in the broader disease community, like XLH, the XLH network. And so in that, we're looking and patients need to start gathering or garnering all sorts of knowledge on business, knowledge on science if you don't have it. Many of us have never started companies before or not-for-profits. You have to understand legislative policy. You have to become an educator yourself within, your work environment, school systems, and all of that matters. But just know that if that's where you feel you have your strengths and you want to play, then own that. Work with Susan and the XLH network and figure out how you can help starting to support that within your community. Even your knowledge about advocacy could help support others from other diseases in your local network as well. In addition to then this kind of architecting your community, there's also a ton of areas, as you all well know, that you can participate in research. And in fact, what we're seeing now is that patient advocates are doing some extraordinary things. They're actually starting nonprofits specifically focused on funding early stage research and drug development. And I know XLH has been at the forefront of a lot of this. They're raising money to fund research. That's extraordinary. We've seen so much success because you guys are willing to put time and effort into areas and ideas and thinking outside the box where others may just see, no kind of forward opportunities. Patient advocates, like what we discussed, have a real huge opportunity here to partner with biopharma. And as biopharma, meaning biotech and pharmaceutical companies, are building out departments, as you all know, focused on patient advocacy and that link between the patient communities, it's so important to become involved. There are extraordinary individuals there that are equally dedicating themselves, and many of them have their whys as to why they are coming to industry and focusing so much on that patient advocacy role to ensure that you feel comfortable, that there's transparency, and that you can all work together. So be open to those relationships. They're important. Also, patients now are becoming early stage investors and biotech entrepreneurs. And that has kind of been an extraordinary shift within our whole rare disease ecosystem. And that I want to apologize, everyone. Susan, hopefully you're not having a heart attack. So as I was saying, again, I apologize, just that there are resources available for you at Global Genes that can help wherever you are on this continuum. So please note that. Second, I just wanted to, and then I'm going to make sure that we have time to open up for questions if you guys have it. But again, this just kind of shows very simply what you all already likely know, but the different kind of areas of drug development from early stage basic research all the way through commercial development. And I'll make sure that these slides are available. But the point is that there's opportunities for you to participate at any stage here. So again, I don't want to belabor this too much, but just to let you know that again, if your interest lies in becoming a participant here or being involved early on, talk to Susan. Um, you know, try to identify places that you can participate. And then note that everything that you guys are doing to collect real world data, to, I don't know if you use wearables to collect data that is helping researchers understand your day to day, that's also very critical. And it's critical throughout this kind of continuum. So, again, back to kind of, uh, the purpose here today. I guess the what I would like you to take away is that sometimes, as hard as it is in rare disease, that there's an extraordinary ecosystem here of individuals that all have their why, that are all so dedicated and committed to serving this community in all different ways. Having been in this kind of ecosystem for a very long time and not always in rare disease, I can tell you firsthand that this is a very special community. And so, in addition to kind of the ecosystem of support that we all have access to, I also am encouraging you, like I said earlier, just to kind of find what resonates with you. Find that place that you can go and make a difference. I heard the most extraordinary song while I was waiting that talks about XLH Strong, and I kept thinking, like, wow, that is so amazing. Susan, you need to share however you did that with other people in the rare disease community, because like that is the coolest thing ever. Maybe someone in your network actually developed that. If so, there's a lot of people that would be interested. It could just be self-help tips that you as a parent advocate are working on or engaged in that help you thrive and just get through the day. Ben and Jerry's ice cream, peanut butter, I don't know, but those are things that are so important and that are really important in helping others flourish and thrive. So if that's your vibe and that's your jam, like make sure that you are available and out there. It also helps you when you can share the things that you're learning. Become active with Susan and the XLH community. It is thriving. It's extraordinary. You guys have over 300 people registered. That's amazing. And I'm sure people from all around the world. Ensure that you can help Susan keep this to becoming, to remain such an active, vibrant community of support for you all. And think about ways that you can help so that you can help ease some of the burden, because it is hard. It is hard. The challenges of leading an organization are difficult. And while there's lots of resources out there, sometimes you just need those people to text you and say, thank you. Oh my God, I know how much you worked on. Or guess what? I want to relieve some of that and volunteer to do this. So just make sure that you remain active and help support your ecosystem, because it's your ecosystem. And then last but not least, please, please, please consider your involvement in current and future research. It is critical. And please be open to sharing what is working and what is not working in your community, because that's how we all learn. So again, this is a massive community of love and support and shared learnings. You have such an amazingly strong XLH network, and know that there's thousands of other diseases out there that either want what you have or would also just like to embrace and connect with what you all are doing and learn from you as well. So with that, I am finished. Thank you guys so much. I am hopeful that you're all going to have an extraordinary week, and I'm available for questions. And if not, then you all get an early lunch break. I don't think I'm seeing any questions or comments. Oh, okay. Kudos to Chris Younger for the song. Yay. Great shout out. Well, thank you so much to everyone. I'm wishing you just an amazing week of learning. Knowledge is power. And again, just look for ways that you can be contributors here, even if it's just to make sure that you're taking care of yourself as well. Because the most important thing is that everyone is thriving and flourishing. And just know that you're all supported and that we are all one massive big community. So honored to be here. Thank you again to Susan and wish you all the best. Thank you so much.
Thank you, Nicole, for sharing your insight and your knowledge and your resources with us today, and also for taking time out of your Saturday afternoon to be here. For now, we're going to take a short break, and we will return at 1:30 Eastern Time for XLH Today with Dr. Emels, Insagna, and Carpenter. Thank you.
A function in Zoom, and I can ask, I can moderate that and ask them, and just alternate who they get or direct them to the right person. Does that make the most sense?